Hello, everybody. Welcome into another episode of the Strength for Your Purpose podcast. So excited to have you back here again for another incredible interview coming your way. We've started off 2022 with a real good string of interviews, and I'm really excited to bring you this one as well. It's someone I've collaborated with before, but have not had on the podcast. This will be her first time on the podcast, and I'm really excited for you all to hear how she tackles what she does and how she helps people. So I am joined by Meghan Field, who is a registered dietitian of 20 years. She is a graduate of Michigan State University. Go Spartans. That's not in her bio. I just added that. And spent much of her career working for larger healthcare institutions. When her and her family decided to move to Maine, she decided it was time to make a shift in her career and started her own private practice, Field Nutrition, which is based in Scarborough, Maine. In her practice, she sees clients for a variety of nutrition needs, such as weight loss, chronic disease like diabetes, gut health, food sensitivities, and has an interest in functional nutrition. Meghan wants people to be in control of their relationship with food. She uses intuitive eating and mindful eating principles to help stop the yo-yo dieting cycle. She focuses on the whole body and not just treating the symptom. Her goal is to work together to figure out what is causing the symptoms and how we can make you feel better through nutrition. Meghan, thank you so much for joining me on the podcast.
Thanks for having me. I'm really excited about this.
Of course, me too. And I want to jump right in here. I want you to talk to me a little bit about your background and what really brought on that shift to doing your own thing. Because as we just said, you know, a 20-year career, most of which was working for larger hospital systems. So talk to us a little bit about how that led you to wanting to start your own thing and what you're doing now.
So being in the hospitals for 20 years, I loved that. It was fun. It was exciting. I was at Brigham and Women's. I was Mass General. I made the Boston circuit of hospitals. So
yeah,
I got to see all of it. And I learned so much from that. I kind of joke that was my master's degree was working in those hospitals. Amazing opportunities. And then I shifted a little bit and I went into the kind of long-term care rehab setting. And I ended up becoming the clinical nutrition manager there. I came into this scene and there was this facility I worked at, amazing facility as well, but they didn't have a good setup for the dietitians. So I kind of came in and took over and cleaned house and I took care of it. And I did that for about 10 years. And that was a different shift. And I managed a team of about 18 to 20 people, dietitians, food service workers. I was intensely involved with like CMS, like Centers for Medicare, Medicaid audits, really high intense stuff on that end. And then when we decided to move to Maine, it was kind of like, what am I going to do up there? You know, this is a time. This is a time to make a big decision and where I want to go and what I want to do.
Sure.
And I was looking around at jobs and what was available, and it just none of it felt right. None of it felt good. You know, it was just like, I just don't feel like I'll be able to make the impact that I want to do and make the change that I want to make in people's lives. And I really enjoyed what I was doing before. I really enjoyed being able to teach other dietitians and help move the profession forward as a manager. But it wasn't what I was wanting to do as a dietitian. So that's why I decided, okay, I need to do something else. And I spoke with a good friend of mine who's also a dietitian in a private practice. And I was just kind of talking it through with her. And she was like, Meghan, have you thought about this? And as we talked through it, I was like, man, this makes sense. This is it.
Yeah.
I want to be working one-on-one with people and without the politics, if you will, of bigger companies.
100%. Yeah.
Yeah. You know, so kind of calling my own shots and, owning my own business. It was never really in my kind of lifetime career plan. but now that I'm in it, it's just like, I'm really enjoying it, and the business side of it. And I'm liking that. But I'm getting back into some really interesting stuff with nutrition, which is the coolest part.
Yeah. That's awesome. And I as a business owner myself, I agree with you fully. The management side of it is a lot easier, I think, doing it on your own than it is working for a bigger entity.
Yeah.
And you get to help people the way that you're passionate about helping people, which is even better. So speaking of that a little bit, you spoke about getting into some cool stuff in nutrition, and even just in your bio, there's a few, for lack of a better term, I'll call them buzzwords that you hear sort of floating around the space of
Yeah.
nutrition nowadays. So I want to talk about a couple of those with you. Speak to me a little bit more about the functional nutrition, because I think that's sort of adding functional in front of things, I think, is kind of a buzzword these days. Functional fitness, functional medicine, functional nutrition. So talk to me a little bit about what that is, and what drew you to that as being a big part of your own practice.
Yeah. So I think, like, when I first started in nutrition, like in school, the word functional medicine, functional nutrition wasn't really around. I think we called it complementary and alternative, integrative, Western, or not Western, but like Eastern medicine.
Sure,
a little different. There was all these different words for it, but now it has now the current term is functional medicine, functional nutrition. And what this does is this still takes Westernized medicine, clinical, what is the word I'm looking for? Clinical based. So there's the studies on this. It's not just kind of anecdotal. It's not just, well, I felt like this and now I feel better. I did this and now I'm better, whatever. There are clinical studies to back and support these things now. It's taken a long time to get there.
Sure.
And so what it is it's looking at the root problem, the root cause analysis. So say somebody comes to me and says, I'm just fatigued. I'm really tired all the time. And, I exercise and I'm doing this and that, and I don't know what it is. And so we'll go through, and I don't want to just fix the fatigue. I'm not just, okay, we'll have some caffeine. That'll fix your fatigue, right?
Right.
No, it doesn't fix the problem. I want to look and I want to see, okay, what are some possible causes of fatigue? Are you having some, vitamin or mineral deficiencies? Are you having some hormone imbalances? Are you having some food sensitivities? So I'll break it down and kind of work through the symptoms to find out what the cause is. We can fix the cause and not necessarily treat the symptoms. There might be some symptom treatment in that, because symptoms are not fun.
Sure.
And we want to make people feel better, as quickly as we can. But so that's kind of a very, very quick intro into functional nutrition.
Yeah. Well, and I really like when people can explain that, because I've had other people on the podcast that do either functional fitness, functional medicine, whatever the case might be. And like you said, it's kind of the buzzword right now in some of those areas. But what it really means is just what you said, is that we're looking at the whole picture. Because sometimes when people think of nutrition by themselves, they think of, oh, what food should or should not eat? Should I be tracking my carbs and fats and proteins and all, these other things? But all of that has a much bigger impact on the body and how the body functions for us in our day. And that's really where that word functional comes from. So
absolutely.
We really need to be looking at more of a personalized nutrition plan for people, based on what we're finding in what you're finding, and how those people's foods affect their day-to-day life.
Yeah. And it gets into more than just the food, because all of it is so connected. We're not just individual parts of our bodies. Right. We are one, component, so if one thing is out of whack, the rest of our body, the rest of our systems are out of whack. So for instance, if you're not sleeping, okay, sleep directly has nothing to do with nutrition, but we all know that lack of sleep, or sleeping poorly, waking up in the middle of the night, leads to people who are gaining weight or cannot lose weight. We know that those studies have been done for a long time.
Yeah.
So making sure someone is sleeping well and helping them with what we would call sleep hygiene, giving them some very specific things that they can do at bedtime to help sleep better. Stress levels. I mean, who is not stressed right now, right?
Right.
Who hasn't been chronically stressed for the past at least 2 years?
Right.
So, stress and what that does to our body overall, everything is so connected, and the gut connection to the brain. And it's just, you can't just look at these parts as individual things. It's the whole body.
Yeah, no, you're 100% right. And that's the other piece of it is people might not think that some of those things are maybe connected to the
nutrition,
the nutritional side of things as well. Exactly.
Right.
So it goes both ways, right? Like it's, those things aren't just nutrition, and nutrition doesn't just cause those things. It's got to be a holistic view of the problem. And there might be some nutritional things that feed into some of those problems, but we also, as you said, have to treat some of the symptoms as well. Because
Absolutely.
there might be other strategies that are needed to address a sleep deficit rather than just nutrition. And I think nowadays, I think the big take home message here is, if you're going to any sort of provider out there that's in the health wellness field and they're not looking at it the way that you just said, you might be in front of the wrong provider, because if we just focus in on one thing and only the thing that it says above their door, and we're not looking at these other things, I think we're completely missing the boat.
Yeah. And we get I've had a lot of people who come to me with just excellent physicians that they're so happy with, that they are looking at the whole body and the whole person.
Yeah.
But then I have a handful of clients who come to me who are just like, my doctor doesn't get it. And I don't want to say that in like a bad way, but they're feeling stuck. They don't want to just have medications thrown at them. They want to change, and I think that's a huge movement right now with people looking to fix what's going on, not just, again, not just do with symptom management and get medications that are going to cause more symptoms or,
Right. And sometimes I think that's not a knock on the provider. Sometimes the system in which they work doesn't allow them to get beyond symptom management. I'm guessing what you do with people to figure out those things takes a little bit more than 15 minutes. And that's
absolutely.
and that's what most people get with their primary care doctor nowadays, if they're working with a primary care doctor in a big health facility. So it makes it even harder for them to recognize some of these things, because they just don't have the time they need to do it.
They definitely don't.
Which is really unfortunate. Yeah.
And which is why, when we circle back to what we started with, and I was saying, I went into this business by myself because I don't want to deal with the politics of, I want to spend the time with my clients. I want to help them and really get into it with them, because that's the stuff that's going to make the difference.
Yeah, it is. And a lot of those people need that time to figure out some of the underlying causes of their habits. And that's actually a great transition into the other part of this that I really was excited to talk to you about, which is the idea of helping people get behind their cycles and patterns of things like yo-yo dieting.
Gosh, I'm going back to like when I was in college, and intuitive eating was the new buzzword then. And so it's one of those things that even, I've read all the studies on all the different diets and everything, and that was just always the one, even back then, that made sense to me. And so, when I fast forward 20 years here, now I am dealing with, because in the hospitals, I didn't do a lot of like weight loss counseling. It was more chronic disease and different things going on. And while I encouraged someone to go and find that, it wasn't what I was doing, because it was kind of a one-off situation in the hospitals. So then so I really started getting into it more recently, like really diving into it. And it's really amazing, the studies that support it, from the maintaining weight loss when you follow an intuitive eating, people who have eating disorders who followed this, and that's, I'm just kind of saying this very generally, but it's so unique, because it's so unique, and yet it's not at all. It sounds so basic when you describe it, but it's not a diet, it's an anti-diet. It's no food is bad approach. And the yo-yo dieting has shown to slow our metabolism. It and what it does psychologically to us when we're restricting foods, it makes you want those foods. You are out of control with that.
Yeah.
Your brain is way too powerful.
Right.
It's not willpower that is making people do this. It's not lack of willpower. It is just it's as strong as a street drug. It's as strong as cocaine and, you know, oxy, all of those things that cause people to crave drugs that do drugs. It's that same sensors that light up in your brain.
Yeah.
So there's no way you're gonna, will your way out of that. It just doesn't work like that.
Right.
So changing a bit of your mindset and how you look at food and your relationship with food is kind of the focus with that. It's recognizing that it's getting in tune with your body, recognizing when you're full, recognizing when you're hungry, so you prevent yourself from overeating.
Yeah.
There's the focus isn't, oh, I can eat what I want. I'm going to eat this cake and I'll stop eating cake till I'm full.
Right.
Like, obviously that's not right.
Right.
But if you choose to have a piece of cake, you don't want to beat yourself up over it. You're going to accept it. You're going to move on from it. And then there's looking at the whole emotional piece to it. Why am I eating this food? Am I eating this food because I'm actually hungry? Am I eating this food right now because I'm stressed?
Right.
And this is not a quick process, because we've had a lifetime of society telling us all of these food rules, how much to eat, when to eat, what's good, what's bad. So it's not a quick fix. You really got to do some self-searching on why you're doing these things. As a parent of young kids, I worry about, like, what am I doing to my children when I'm like, you need to eat your broccoli.
Right.
I think about this and I'm like, oh gosh. But so getting into there's a whole psychological piece to understanding why you're eating and what you're eating and when you're eating.
Yeah. And speaking of the way you're talking to your children, I kind of, whenever I've talked about this or even just thought about this in my own situation, I always go back to school and how rushed some of the schedules are in a school setting. Because I really think some of this mindless eating
I'm like, you really want to get me going now, don't you?
Yeah. I thought this might, Megan. I thought this would be a good topic for us to talk about as you went there. But I really think this probably started back in maybe even as early as like 4th or 5th grade. I don't recall it being as rushed earlier than that, but the older you get, you tend to kind of notice more of those things. I think so. Back in elementary school, I think mindless eating.
Oh, yeah.
The pattern develops there, and then it starts expanding to other meals in our day, not just our meal in the middle of the day at school. So what are your thoughts on that? And to expand on that even more, are there things that we as parents need to maybe recognize and help to try to curb that a little bit earlier, so that outside of school, which is the only thing we can really control right now,
Yeah.
how can we improve upon that if we can't improve upon it as well as we would like to in the school setting?
Yeah, well, so first off with school lunches, they're definitely, the time is limited. I understand, like, everything has to be so regimented and time controlled and stuff,
Right.
and to fit in the day. I mean, do we consider adding 15 minutes onto our day so they can have a slightly longer lunchtime?
Right.
It's not asking for that much more for these kids to have a little more time.
Mm.
So I don't know if you're aware, but right now in schools, because of COVID, they watch TV while they eat so that they don't talk to each other. So they put
Oh,
on, yeah.
oh no.
And I get it. I absolutely get it. They're trying to
Yeah.
keep the kids occupied so they're not talking with each other while they're eating. And I totally understand. But man, these are those formative years, where they're
Mm,
really they're creating those habits, and
mm.
it's creating that mindless eating habit. And even more so than what you were thinking of,
Right.
because
Right.
they're trying to keep them from talking. And it's like, well, if you come sit with me, I'm going to tell you to talk to your friend while you're eating, and like slow down and sit at a table and put the TV away or turn it off or put your phone down.
Yeah.
Take some deep breaths, take some time to just take a couple deep breaths before you eat, and just slow yourself down, slow your mind down. They don't have time for that.
Right.
So yeah, if you can at night for at least one meal, sit down and have that meal together. Don't eat in the kitchen, wait till everybody gets to the table. If you got kids in high school, you're probably off running to do sports and stuff. Life is just busy. We
Sure.
have made it so busy. You can't get it to every dinner. Go for one dinner a night where you're all at the
Mm,
table. Sunday night dinner, um, and that's where you got to start. You got to make one step.
yeah.
It doesn't have to be, okay, now we have to do every single night, every single dinner at the table. Like, no, our lives are so busy now. That's
Mm.
not going to happen. It's not going to change because I think you should have more mindful meals. Like, I know that's not going to change.
Right.
But if you can make one thing more mindful with your eating, that's a step in the right direction.
For sure. And some of those habits you mentioned, you can even carry over in those more hectic meal situations. Whether you're eating in the car on the way to practice or whatever the case might be, you can still, take a couple of the deep breaths and actually think about what you're doing and not, be again in your phone and the TV or just rushing to eat for the sake of I've got to eat before I go do this next thing. So even if it's not like you said, even if it's not a perfect situation, you can take some of those practices and still be a little more mindful about what you're doing, which can be
Absolutely. The
helpful.
5 seconds to take 3 deep breaths before you eat, that is not going to make a difference in your time in your day, but it
Right.
could make a difference in your mindset of how you eat and how you're looking at the food, and if you're
Mm,
paying attention to what you're eating to prevent yourself from overeating at that
mm,
meal, because now
yes.
you've reset your mind, you've slowed down for 2 seconds,
Mm,
5 seconds really.
5 seconds. Right. Right. Or those 3 breaths. Yeah. Yeah.
Yeah.
No, that's fantastic. So I've got a couple more questions for you, but before we get into that, I want you to go over a little bit about what it looks like when someone comes into your practice, because you've talked a little bit about what you like to focus on in certain areas you like to help people in, but when someone's onboarding with you in your practice, what does that process look like for them?
So when someone comes to me, I like to spend a little bit of time just, getting to know why they wanted to come see a dietitian. First of all, if they haven't seen a dietitian, I'll explain to them kind of what we're going to do. And it's talking. That's what we do. We talk.
Mhm.
I actually I don't know if I actually have put a single person on my scale. I don't put you on the scale
Great.
because that's yes, people come to me for weight loss and everybody kind of wants some weight loss, but the idea is that I'm helping people change their relationship with food. So standing on the scale isn't the that's not the big win for me.
Mm,
So when you come into my office, a lot of people do their own weights. Because I'm not going to put you on a scale. I
yeah.
have one there. But and it's just kind of, it's we're talking to each other. We're sitting across from each other, talking about what's going on. Um, we'll get into, different habits, and just kind of get to know each other, on their their health history. I assess medications, because medications make a whole, they make you lose your appetite. They make you increase your appetite. They alter your gut microflora. They alter your, bowel movements. So I also look at medications. It's not just, you're going to come in and I'm going to tell you to eat more carrots.
Right.
I might tell you more carrots, but
sure.
Again, I'm going to look at the whole piece too. So understanding like your whole past medical history, even your family's past medical history, helps give me an idea of, who you are, in what different situations we could be dealing with, let alone are dealing with.
Yeah.
So it's much more clinical in medical than I think people realize, but yet I help with a lot of the day-to-day kind of issues around nutrition.
Yeah, that balance is really important, I think. Yeah, fantastic. Well, I have two more questions for you, but before we get into that, I want you also to tell people how they can find you if they've heard something listening to the podcast here that has really piqued their interest. They want to learn more about you and get in contact with you about your services. How do people go about doing that?
Oh, thank you. Yeah. So I have my website. It's www.fieldnutrition.net. I'm based out of Scarborough, Maine, and you can also find me through Nutrition in Motion, which is kind of like my background company that helps me with billing and different things like that. So I'm under kind of two entities, but my company is Field Nutrition.
Perfect. And go ahead.
And then I was going to say, if anyone wanted to email me, it's mfield, MFIELD at NIMRD.com.
Perfect.
Yeah.
Yeah. And we'll make sure we have all that in the show notes so people can have easy access to that as well. So I encourage you all to take Meghan up on that and shoot her a message and just find out a little bit more about how she can help, because I really like her approach. It's fantastic. Awesome. So I just got two more questions for you, questions that we ask all of the guests on the podcast here. So number one is, what is your definition of strength, Meghan?
Oh gosh, my definition of strength.
Yeah.
So that's really interesting. I think I would have to say is somebody who can ask questions when they need help, when they don't know the answer.
Yes.
It's almost like knowing your weakness.
Yeah.
If you will.
I love that. Yeah. That is, we've had variation. It's always a little different. Everyone says something a little different, but I don't think that we've ever had anything in the realm of that. That's really good. I like that. That's a great addition to the definition of strength. That's fantastic. And the other question is, what is your true purpose in life?
Oh my goodness. My true purpose in life?
Yeah.
Wow. I don't know if I've thought about that. Gosh, I feel like my true purpose in life is to just to do well by others. Being ethical has always been very important to me. That's always been number one in how I've practiced, is being ethical. So yeah, I have to say that's number one. And then as I've become a parent in these last 7 years, that's obviously shifted, is to create, good human beings.
Yes, that's important.
Yeah.
That's important. Well, that's awesome. Well, Meghan, thank you so much for joining me. I really appreciate it. I really appreciate what you do and how you help people, and can't thank you enough for spending some time with me here on the podcast and sharing that with others.
Thank you so much, Phil. I really enjoyed this.
Of course. Well, I'm glad to hear that as well. And I hope you all out there listening enjoyed it too. If you did, please be a friend and tell a friend. Share this with someone you know, love, and respect, who can get the same value out of it and have some added value into their life so they can be living happier and healthier as well. And make sure you tune in next week. We're continuing these awesome string of interviews that we've had here, kicking off 2022 with a bang. Just getting all these people that are so good at what they do and really help energize me to want to help more people too. So I hope you all have been enjoying it as much as I have. And we'll see you back here next time on the Strength for Your Purpose podcast. Go make it a great week, everybody.